knock. Hi, I'm Taylor and I'm going to be your nurse today. Can you please tell me your name and your date of birth?
Samantha Cook, 2/27/90.
And do you know what the date is today?
Yeah, January, I don't know, is it 4th?
4th.
2017.
Okay. And do you know what location you're at today?
Yeah, I'm in Sterling, Colorado.
Okay. You're alert and oriented ×3, so you have good cognitive function. It's one thing I wanted to check. I'm going to give us some privacy today before I start. And I'm going to wash my hands, okay?
Okay.
Alrighty. So today I'm going to use a CMS approach, and what that is circulation, motion, and sensation. And I'm going to do a head-to-toe assessment on you. So I'm going to start from the head and kind of go down. Is that okay with you?
Yep.
Okay. So first off, I'm just going to do a little general appearance on you. I just want to make sure your temperature is good. You don't feel too warm or too cold. You feel pretty good. So that's good. I just want to check your circulation. So I'm going to check your fingernails. Your cap refill is less than 3 seconds, so that's normal. And you have no clubbing of your nails, so you're not hypoxic or anything like that. I'm going to check your skin trigger for dehydration. And there's no tenting, it's elastic, so that's one good thing that I wanted to see. And then now I'm just going to kind of move on and start with your head. So I'm going to feel your head. Is there any tenderness at all when I feel it?
Mm-mm.
There's no nodules and it feels pretty good. And you have good hair distribution and your skin looks good. You have good posture, so those are all good signs. Now I'm going to go with your sinuses, so I'm going to palpate your frontal sinus. Is there any soreness or tenderness when I palpate that?
Nope.
No? Okay, now your maxillary sinus.
Okay.
How about that? Is there any tenderness there?
Nope.
No? None at all? Okay. I'm going to go ahead and I'm going to feel your carotid pulse. And then I'm going to make sure your trachea is midline, and it seems to be midline, so that's good. Now I'm going to palpate your thyroid if you just want to bend your head down and to the right a little bit. I'm going to push it, and yes, I can feel it a little bit, so it is there, and it feels normal. It's good to
I
me.
do have a thyroid problem.
But it feels fine. Alright, so now what I'm going to do is I'm going to listen for bruits over your carotid, okay? So I'm going to make sure my bell is on, because you use your bell with the stethoscope to listen to bruits.
Okay.
And I do not hear any, so that is a good sign. Very normal. Alright, so now what I'm going to do is I'm going to go on to your lymphatic system, okay? So you have lymph nodes many places, so I'm going to just start by filling some, okay? So your pre-auricle ones are right here. Just going to palpate those. Your post-auricle. Your occipital. Okay, now I'm going to palpate your submental, your submandibular, your tonsillar, your anterior cervical, your posterior cervical, your supraclavicle, and your infraclavicle. And everything feels good. They don't seem inflamed or anything at all. So now that we did that, I'm going to do a little, I got to test your cranial nerves throughout this exam. So I'm going to start with testing your cranial nerve 5 because it deals with your face. So I'm going to get a cotton ball over here. Okay? And I'm going to use this. And I'm going to have you close your eyes, and I'm going to place it on your face, and you tell me which location on your face I'm placing it.
Forehead.
Your forehead. Very good.
Cheek.
Good.
Chin.
Chin. And then I'm also going to just kind of palpate your mastoid, okay? And then I'm going to also test your cranial nerve 5 by having you open and clench your jaw. There you go. There's no rubbing, and it feels pretty normal, so that's good. Your cranial nerve 5 is intact. Now we can move on to your cranial nerve number 7, and that is facial expressions. And so can I have you smile for me? There you go. Can you try to frown? How about puffing your cheeks? Good. And then just close your eyelids for me. And there you go. That's cranial nerve 7. So everything is working properly. It's intact. That's good to know. So we did our lymphatic. Now we're going to move on to your ear, okay? So for the ear, I'm going to use my otoscope. And I'm going to just check the outside of your ear, and right here it's not red. Is there tenderness at all? No, no tenderness. So I'm going to use this, and I'm going to pull up and back, and I'm going to look in for different aspects in your ear, okay? So I see your tympanic membrane. There's a little cone of light at 5 o'clock, so that's very normal. It's not red. I see your pinna, your malleolus, and your umbo. So everything seems to look very good in your ear. You have a little wax, but everyone seems to have wax. So we're good there. In your ears, you seem to be hearing okay? Okay, I'm going to do a little whisper test for you. And I'm going to whisper a word and you tell me if you can hear it, okay?
Blanket.
Okay. Very nice. That's good. And then I'm also going to have you stand up. And I'm going to have you put your hands to your side and close your eyes. And you have good balance. Good. Okay. So that right there was the Romberg's test and the whisper test I just did behind you. Those check your cranial nerve number 8, okay? So balance, your ears really have to do with balance. So you have good balance. That's good to know. All right, so now we're going to move on to your eyes, okay? So a cranial nerve that I'm going to check with your eyes is cranial nerve number 3, and that's just opening your eyelids, and obviously your eyes are open, so that's intact, so that's very good. So now I'm going to grab my pin light, and I'm going to check your cranial nerve number 2, 3, 4, and 6, okay? And so I'm going to do the 6 fields of gaze, so if you can just follow the tip of my pen, I'm going to move it around. Use your eyes to follow it. Very good. And your eyes are moving exactly where it's going. So all those cranial nerves are intact. So that's very good to know. Now if you could just look past me, I'm going to shine this light into your eyes to look at your pupils, okay? So just, very good. I'm going to do the other eye. Very good. Your pupils are equal. They're round. They're reacting to my light. And now I'm going to check to make sure they accommodate, okay? So I'm going to point my finger here and I'm going to cover this one eye. And then I'm going to leave it here. And your eye accommodated to that, so that's very good. You have Perla, your eyes are looking great, okay? And they've done a Snellen chart test previously, so I'm not going to do that. That's when you read off the little numbers on the chart, okay? So we won't do that. But next up, we're going to do your nose. So first off, I'm going to check your cranial nerve number 1, which is olfactory. So we're going to test for scent. I'm going to just have you close your eyes so you don't see the color of it. It may affect it. And I'm going to close one nostril. Can you just smell that and tell me what it is?
Vanilla.
So on all these tests in a real physical exam, I would check both ears, both nostrils, both eyes. I would check everything twice, but for the sake of time, I'm not going to do it on this, okay? And then are your nostrils, can you blow air out of them? Okay, I just wanted to make sure you can get air through. That's good. And your septum is midline, so your nose looks very good. Next up, I'm going to do your throat and your mouth. So I'm going to take a little pen light here, and I also need this stick. A pen light and this stick, and I'm going to shine this in your mouth, and I'm just going to look around, okay? And I'm going to have you say ah first. Very good. So your uvula and your soft palate rise at the same time, so that's the first thing I wanted to see, because that's cranial nerves 9 and 10, so I wanted to check those. And then also, I just want to look around in your mouth a little bit. Your mucosa is pink and moist. It looks very good. Your teeth are intact. Your tongue looks normal. Have you got your tonsils removed in the past? Yes. Very good. They are not present, so they're size grade 0. So that's just one thing I wanted to check here. And then also I'm going to check your cranial nerve number 12, okay? And with this one, I'm just going to have you stick your tongue out and move it side to side, up and down. There you go. You have movement in your tongue, so your cranial nerve 12 is doing great. Next up, I'm just going to move down to your chest now. We've got everything up there. So if I can kind of just have you turn to the side, I'm going to just take your jacket off probably. Okay. I need to check your AP to transverse ratio of your chest. And right now it's looking about 2 to 1, which is normal. If it was 2 to 2 or 1 to 1, your chest would be out, and that means you might have COPD or barrel chest. So you're looking great. It's one thing I wanted to check. All right, so what I'm going to do here is check your lung sounds, okay?
Okay.
So I'm going to have you take deep breaths for me, okay? And I'm going to do got to get back to my diaphragm. I'm going to do a Z pattern. Just take a deep breath for me, please. Another one. Another one. Another one. Another one. Another one. Okay, your lungs sounded clear. I didn't hear any abnormal or adventitious sounds, so that's good. I'm also going to have you do a thing, and it's called egophony or egophony. I don't really know how to say it. But what I'm going to do is I'm going to do the same thing, listen to you, but I'm going to have you say the word E, okay? Or the letter E. Okay, ready? Go.
E. 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 E.
Okay, sounds very normal. There's nothing abnormal about that. Now we're going to do tactile fremitus. So I'm going to have you say the number 99, and I'm going to go feel your back just for vibration, and it's normal to have vibration, so that's what I'm feeling for, okay?
Okay.
So I'm going to make sure the camera can see me, okay? Okay, so can you say 99?
99, 99, 99,
And I'm just going to feel it here too.
99, 99, 99.
Okay, that feels very good. I can feel some vibration, but it's not too much, and it's there. So you do have good vibration in your lungs. Now that I have you here, I'm going to, oops, sorry for shocking you.
Okay.
Your kidneys are back here, and I'm going to check for CVA tenderness. So I'm going to give you a little, kind of almost like a little punch and kind of tap, percuss it a little bit.
Okay.
And just tell me if it's tender at all.
Nope.
No tenderness?
Nope.
Okay, very good. I'm going to have you lay down if you could for me, please. Okay, I'm going to move on to your cardiac now, okay?
Okay.
If that's all right with you. Okay, so I'm going to listen here. Well, first, before I start this, I'm going to feel here just to make sure you don't have any, like, heaves and thrives, and it doesn't look like it, and I don't feel it, so that's good. Now I'm going to go ahead and listen to your heart, and I'm going to go in a pattern. So I'm going to start with your aortic, now your pulmonic, now your herbs, now your tricuspid, now your mitral. And everything seems to be doing just fine there. So now I'm going to listen to see where the S1 sound and the S2 sounds are the loudest. So let's try up here by the base. So your S1 sound is sounding the loudest here at your base. And your S2 is sounding the loudest here at the apex of your heart, okay? So now what I'm going to do is kind of just move on to your pulses. You have many places where I could check your pulses in your body. So I'm going to start with your temporal pulse, just right here. And I would do this on both sides of the body, but I'm just going to do it here, this one side for now. So carotid. Oh. And your brachial right there. Very good. So then there's two on your feet here, and if I could just take your shoe off, that would probably work the best for me.
Yep.
So you have your posterior tibialis right here. I'm just going to feel that one. And your dorsalis pedis. So all your pulses are bounding. They're not too much, but about 2+, so they feel, I'll leave that off just in case I need that foot again.
Okay.
They feel pretty good, so that's good. And they're all equal throughout, so that's what I wanted to feel for.
Okay.
And they're consistent. They're not skipping beats. That's good. It's exactly what I wanted to see, okay?
Okay.
So now that we have you here laying down, I'm just going to go ahead and check your abdomen, okay?
Okay.
So I'm going to check your bowels. I'm going to inspect, first of all, so you just lift that shirt up for me. So I'm looking, I don't see any like abnormal discoloration, bumps, or anything. Your abdomen looks normal to me. So first of all, inspecting it. Now I'm going to osculate it. So that's just listening with my stethoscope here. So I'm going to go all 4 quadrants. And I'm just listening for your bowel sounds right now is what I'm doing. And that's very good. Your bowel sounds are active in all 4 quadrants, and that's what I wanted to see. Now I'm going to palpate it. Just tell me if you have any tenderness at all in any of these 4 quadrants. Do you have any?
No.
No. Okay. Good. Now I'm going to percuss, so I'm just going to tap on my hands here, listen for different sounds, okay?
Okay.
It makes different sounds when I'm over organs or just like air spaces, so I just wanted to hear for the sounds there. All right, so now that we have your abdomen done, we can put your shirt down now. I do want to have you sit up for a second for me. We're going to just test your musculoskeletal a little bit. So I'm going to test your hand grasp. Can you grasp there?
Oh,
Good,
sorry.
Good strong grasps. Okay. And then one other cranial nerve I'm going to test is cranial nerve 11, and that's kind of just shrugging of the shoulders.
Okay.
So can you just push against? Very good. Got some strong shoulders there. Let's just do some range of motion. So can you lean against? Lean against. Can you go up and down and side to side? Good range of motion in your neck. How about your arms? Can you move them around in circles? Very good. can you supinate and pronate your hands while you're here? Good job. How about, can you bring your knee up and to the side? Let's just see the range of motion in your legs. How about extend it out and then flex it back in? Very good. Your range of motion is very good. And then I want to have you dorsiflex and plantar flex. So dorsiflex, and we'll let the camera see. Dorsiflex, plantar flex, and then just push against me. Just want to see the strength. Okay. So you have good range of motion, it seems like. Okay. That's the main thing I want to see here, okay? Now we're going to I'm going to go to a little sensory because we want to make sure you have sensation in all your extremities and you can do sharp and dull. So I'm going to go on over here and do some sensation tests. Okay. So what we got here, I have a sharp object and a dull object in my hand. And I'm not going to let you see them because it might give it away. But I am going to have you close your eyes and I'm going to tell you what you can expect. I'm going to give you the sharp one. So this is going to be sharp. Okay?
Okay.
And this is going to be the dull one, okay?
Okay.
So now I'm not going to tell you, I'm going to have you tell me which one's sharp.
Okay.
So I'm going to do one. Tell me if it's sharp or dull.
Sharp.
Okay, and how about here?
Dull.
Okay. So now I'm going to do it on your lower extremities just to make sure you have good sensation down here. Close your eyes again.
Dull. Sharp.
Very good. That is correct. I was using sharp and dull. So you have good sensation. That's what I like to know. So here's a couple more tests that I want to do with you. One of them is gravesthesia, okay? So I'm going to have you close your eyes. I'm going to use your hand. And I'm going to draw something in it. And I want you to tell me what I'm drawing.
Okay. A bee.
Very good. Okay. Keep your eyes closed. Now I'm going to do sterignosis.
Okay.
And I'm going to put an object in your hand and I want you to tell me what that object is.
It's a button.
It's a button. Very good. So you have very good sensory and you're feeling all of these things, which is what I like to see. Now we're going to just test a little bit of other things with you. So I'm going to have you stand up, okay? And make sure the camera can see you here. I'm going to have you take your arm out and put it to your nose. Yeah, both sides. Very good. Okay. Now I'm going to have you take the heel of your foot and bring it up and down your shin. Okay. Very good. You have good. I'm testing your balance and just your coordination here too. So that's good. Now I'm going to have you walk on your tiptoes. Very nice. Now come back so the camera can see you just fine. Now walk on your heels for me. Very good. And then just walk normal. I just want to assess your gait there. There you go. Very nice. Okay. Now can I have you sit back down for me? Now that you have that shoe off, I'm going to test your Babinski reflex. Okay. It's good. We want it to be negative. It's usually positive in babies, but your Babinski reflex is what we would expect to see. That's very good. And next up, we're going to go on to some reflexes, okay?
Okay.
So I'm going to have a little hammer here. It's a reflex hammer. And I'm going to hit different portions of your body and just see if those reflexes are intact, okay?
Okay.
So I'm going to start with your brachial. See that her hands switch there? That means her reflex is working. Okay, now I'm going to do your triceps. Right there, it's working right there. Okay, the other reflex I want to do is your brachioradialis. So I would always do these on both sides just to make sure, but here we're going to do this because her watch is on that side. Her hands twitch a little bit, so we're seeing that reflex. Okay, now I want you to scoot back on the bed so your leg is relaxed and dangling. And I'm going to... Were you
Yeah,
good?
it worked.
Okay, it worked. Okay, now that was your patellar reflex. Now I'm going to go to your Achilles reflex, just back here behind your foot, and it jerks. So all your reflexes are very well intact, and that is what I like to see. Do you have any concerns or any other things that are bothering you here today?
Nope.
No? Okay. Well, that really kind of completes my head-to-toe assessment. I went from the caudal, I went head-to-toe, okay.
Yeah.
So, and that's it. And I will let the doctor know if any concerns I have, okay? And that should be all. Thank you for your time.
Thanks.